The broadcast is now starting. All attendees are in listen-only mode.
Good morning. Here is Willi Strootman from Empirica, together with
Strachel Biro from Empirica.
And Christiane Levine from Empirica.
Thank you very much for joining the webinar, the first webinar on the blueprint. And Strachel, do you have a few instructions?
Yes, so I assume that most of you are using your laptop or PC instead of the phone, which is great for a webinar. If you look at the panel of GoToMeeting, you can also find attached a handout with the slides that we're going to present. Can you please, if you hear us well, can you just someone write in the chat so that we know that you can hear us well?
Okay, we can continue. Thank you very much for responding, and thank you again for joining. Can you please display the agenda? We will first listen to our project officer, Anne Offray. Anne, can you hear us? And please, the floor is yours.
Hello. Good morning. So I'm joining by phone, as I was explaining to Stahil and Veli, because I'm having technical issues to joining via internet. But I hope everybody can hear me well. So I'm Anne Offray. Some of you have met me and the project officer of WIFOAHA. And I've been asked to give a short introduction. I will try and keep it short, actually, and give you some hindsight into the policy agenda and how this relates to the innovation partnership and the blueprint in particular. So the policy agenda, in particular, I want to highlight a number of items that we are currently discussing or that have been approved in the last few months. The first one is, as you all know, the communication on digital transformation of health and care. And I think this is already in the mind of all of you, that this is the strategy, the EU strategy that needs to be followed, because you've made the effort of actually aligning the blueprint with the communication. I won't repeat the detail of the three pillars, but you know them all: access to health data and sharing of health data. And then second is actually bring together all these data for research and personalized medicine. And the last one is promoting digital tools for empowerment of citizens. So this is the strategy we have to work with. Something to also have in mind, maybe this is not something we highlight too often, is also the legislative framework that we're in. And to some extent, or actually to a large extent, it impacts the health and care field, so we shouldn't forget it. I'm sure you're not, because you're concretely involved in implementation, but directives or regulations such as the GDPR, they have a huge impact on the work you do. Also the medical device regulation, the future one, but also the ongoing one, the directive, the cybersecurity pact, or legislation such as the product liability directive. These are things that we have to keep in mind. And there are a number of ongoing discussions on adaptations of this legislation, or we are in the process of the implementation of this legislation, such as the GDPR, which is a quite far-reaching regulation having an impact on all sectors, and including the health and care sector. So this is to set the frame. And actually, something I want to emphasize today in this short introduction is the ongoing discussions on the next multi-annual financial framework, which will start in 2021. So it may seem quite early, but actually discussions have started a lot before, because we already have the proposals of the European Commission on the different programs and how the money will be spent, and now it's being discussed at the Parliament and the Council. And something that is very relevant for the Innovation Partnership and for you today is the different programs I want to highlight. First, the Horizon Europe program, which will be somehow the follow-up of the Horizon 2020 program. So in this proposal, of course, there will be money for health. There's actually a health cluster, a whole section dedicated to health, and this is a good thing. In this framework, there are ongoing discussions. For you to know, we are discussing what kind of partnerships we will have in the future, and in particular the ones that are actually have their own calls, meaning they have their own money to spend. So I'm thinking of what could come after AAL, or what could come after the Joint Programming Initiative on More Years, Better Lives, which are related to our work. This is quite important to have in mind, because the Commission has this objective of streamlining the number of partnerships. And we are trying to push for having one on digital innovation, large-scale innovation in the field of health and care, and in the context of an aging society. So this is what we're trying to push for, and we are currently discussing this. A couple of colleagues have been invited from the Innovation Partnership. I've been invited to a meeting in this regard on the 16th of November. And why I'm saying this? Because we're hoping that the Innovation Partnership will feed into these reflections on partnerships from a substantial point of view. Also, one thing I would like to highlight is another program which I think could be or will be, we hope, used in the field of health as well. It's the health and care. It's the Digital Europe program. This is a new program proposed by the Commission, which aims to focus on deployment. So this will be less at research and innovation level, but really deployment. And there are a number of priorities, 5, that have been identified. It's not yet clear how money will be split between these 5 priorities, but I'd like to list them for you. One is on artificial intelligence, and it is very relevant for the actions that are, for some of the actions actually that are led by you. And the second is on high performance computing, also can be relevant, and if we have enough data actually to feed these high performance computer, that can be very useful. There's one priority on cybersecurity. Again, this is essential to ensure the trust of citizens, the trust of health professionals, that there's security of the devices, security of the digital solutions can be demonstrated. So it's important to have something in this field. Another part also essential for us is on digital skills, advanced digital skills. It's relevant for citizens and health professionals, health and care professionals. And finally, there will be a part on digital transformation and interoperability. And also here specifically health is highlighted and is identified as a potential sector where there could be funding. So this is to give you an overview of this program. And finally, there's another program which could be of indirect interest, I would say, related to digital solutions, is the CEF, so Connecting Europe Facility number 2, version 2, and it will focus on connectivity. So why I'm saying this, related to the discussion today of the blueprint, is really that, reading the blueprint, I could see that these topic areas that have been identified, this actually making things very concrete, it can be very useful actually to feed into these discussions. There's a real added value in general of the innovation partnership to feed into these discussions. It's a specific community with a specific approach, and I think this specific approach, for instance, which is going beyond the medical approach, which is not only curing, but it's not only about patients, it's about care, it's about citizens, it's about empowerment, integrated care. The fact that we have in this innovation partnership a large number of regions that are actually implementing on the ground a number of actions, the fact that we have specific tools in this innovation partnership with twinning, for instance, I think there's a real added value in using what has been done in innovation partnership to feed into the discussions on the future programs of funding, and try and shape these for take up of some of the tools that we've been using, and hopefully as well shape the future partnerships of the MFF, of the next multi-annual financial framework. And specifically on the blueprint, I think the main added value is these use cases that you've developed, that are, as I was saying, making the priorities extremely concrete and can substantially help develop the content of these next future programs, and also the connection to regions. So that's the message I wanted to convey, that we have with the blueprint a good substance that can concretely feed into these discussions on future programs, be it Horizon Europe, be it Digital Europe program, or Connecting Europe facility. So for the next steps, of course, you will have an implementation phase by the reference sites and action groups. I think one thing that will be important in the context of this, the implementation of the blueprint, and this context of next multi-annual financial framework, is that all the content of this blueprint need to be taken up, first of all, better known at also at European level. I think the Conference of Partners will be a good opportunity to raise awareness on the content of this blueprint and the concrete use cases, with DG Connect, so that's already the case, but also DG RTD, DG Santé. So we have to raise awareness on the work that has been done, because this is very, very substantial. But also with member states. So of course regions are there, but there is maybe a missing link if we want to see reflected some of the priorities of the blueprint into the next multi-annual financial framework. We need the member states to know what we've been doing, what you have been doing, because they are the ones who negotiate the next program. So this, I think, regions should be mobilized to therefore mobilize the member states. It will be very important. And of course, the regions which are already highly mobilized should play a key role in the implementation, possibly with tools like structural funds. So this was the main message for me, that actually there's a context that is capital to seize the opportunity of this context of multi-annual financial framework. Timing is right. I would say that we have very good content of this blueprint, and now we need to raise awareness about its content at all levels, to see these priorities reflected. So thank you very much, and happy to listen to this webinar.
Thank you very much, Anne, for this extremely interesting and relevant for all of us update. That is really very much appreciated. Let's continue now with a presentation on the progress that the V4H project, together with the Blueprint partners, has made over the last months. And we call this not the new blueprint or an update of the blueprint anymore, but rather an evolution of the blueprint, where we consider that we are evolving some missing or not well highlighted, not well elaborated parts from different perspectives, and there is much more to come. So it is a process, and we just want to report to you where we stand in this process, how we are progressing. And just to remind ourselves, this was the blueprint document we all acknowledged and discussed at the summit and it was published in a updated version in January 2017. It is a strategic vision developed by stakeholders reflecting common policy vision of European policymakers, civil society, professional organizations, and notably as well industry. So a large set of stakeholders committed to developing this vision and implementing it as well. And it aims to create a digital single market for active and healthy aging innovation, mobilize investments, guarantee further commitment. The objectives of the V4H support action related to the blueprint are to further support the co-development, promotion and implementation of the blueprint and its recommendations, to identify, specify key ICT enabling technologies and high impact, what we call use cases or user scenarios in active and healthy aging, and to mobilize stakeholders, encourage them to commit to concrete actions. And you can see here the expected outcomes up until 2020 to engage further all stakeholders, issue updates, and in particular focusing as this current update is on demand side needs. To develop the set of user scenarios and develop policy recommendations and concrete actions formulated for different stakeholders, including policy decision makers. Now, the blueprint partners were originally called champions, but the circle of champions was enlarged to include representatives of the demand side, regions, healthcare authorities, and similar partners. And the first interim results we presented to you at the Conference of Partners in February 2018. I have to stress that they are still all valid. We reported there a lot of good practice examples and some very concrete recommendations, which will be further taken up as we go in the process. What we want to present to you today are the results of the so-called personas development, and they're being presented to action groups, reference sites. We will do that on a kind of more regular basis up until February 2019. The 4 priority topic areas we did focus initially upon and that were presented at the Conference of Partners, that are shown on this picture. Data analytics for predictive risk stratification and prevention, proactive prevention through empowerment, self-management, monitoring and coaching, digital solutions for connected health, and also for integrated care. And for each of these 4 topic areas, we developed a detailed picture about the situation in Europe with regards to needs to be addressed, key ICT enabling technologies available, barriers, challenging to scaling up, solutions and recommendations. The further step after the Conference of Partners was to develop the personas that you can see on this slide. We followed a persona called Jim, which was developed by the Think Local Act Personal Partnership in the UK. Those personas do represent types of personas, not necessarily concrete persons, but actually some of those were inspired by real persons that were among relatives, patients or friends by the persona developers. And what we wanted to do was to better identify the needs of these persons, both in healthcare and social care. 12 population segments were developed, 4 groups along the life course, from children, young adults, working age adults, retired persons below 80 and persons aged 80 plus. And 3 major groups of generally well or good well-being, chronic conditions combined also with social needs, and what we called complex needs, people with several chronic conditions, definitely with social care needs and the comorbidities, etc. So this was our starting point to look for digital tools that can target the persona's needs. And you will learn more about that from our presenters in just a minute. Very briefly about the next steps. Now that we have developed those personas and identified their needs, and we are further improving on those, the next step is to develop the high impact user scenarios. We are now receiving from you, from many of you, we have already received indications of available best practices, solutions that have been implemented in the regions. And we are looking for regions with strong experience that are willing to share their knowledge and support the scale up and deployment of particular digital solutions across Europe. While developing the user scenarios, we will for sure consider interactions of the personas. Now, the personas that we have developed are kind of static pictures, but they do interact with healthcare providers, with social care providers. So we want to highlight those interactions and involve also the needs of other key actors in the process, like GPs, nurses, social carers, etc., but also public health authorities. And we want to focus on outcomes of a high impact on patients and the healthcare system. along with high scalability and replication potential. And of course, improve further our recommendations, but definitely come up with very concrete, recommendable for large-scale deployment solutions. Now, Sue, I hope you are online and can hear as well. Sue Hun from the Public Health Agency in Northern Ireland is our next presenter, and she will focus on unmet needs of generally well personas.
Good morning, everybody. Can you hear me?
Very well. Thank you, Sue.
Good morning. My name is Sue Han. I work for the Center for Connected Health and Social Care based in the Public Health Agency in Northern Ireland. Today, I'm going to give you a short briefing about the blueprint personas and focusing on the personas that are generally well and focusing on one particular one, which is an elderly person. Next slide, please. So under the generally well personas, we have, as you can see on the top, there are 4 different types of personas. We have developed ones for children and young adults, working adults, retired persons, and persons age 80 and above. So of the 4, you can see they are different individuals from young person, and we try to portray different aspects of that particular individual or persona. But generally, these are focusing on people who are well, not have any long-term condition. They may have other responsibilities. They may have indication of things that might lead to a condition at a future stage, so that we can maybe encourage solution providers to look at things that are preventative. So as you can see, when I focus on one of the individuals later, you will see that there are different aspects that we are trying to portray, so that to give more opportunities for interaction with the persona and to look at different types of solutions that we could be using. Next, please. So just to give you an overview of the posters in general, as you will see, the posters are divided into 5 particular sections. The main section is a summary, which you have an image of the persona itself with some basic information. And on the left, on the right, you will see actually the relevant ICT skills. And we felt that this was quite an important aspect, because then it gives digital solution providers information about the types of skills that the individual may have, and be able to target appropriate solutions to the appropriate personas. So that's why we have focused on some of the relevant ICT skills. And then in the middle, you have a summary, and that basically gives you a summary whether the person is well, unwell, has a long-term condition, chronically ill, or generally at an early stage. Then the contextual topics really are, there are kind of 8 areas which we are focusing on, and these are trying to again give more life to the persona themselves. They're things that are, for example, important to the individual, what their health and lifestyle concerns might be, what are the things that they're doing on a daily basis, some of their health tests that they might be eligible or should be themselves availing of, and then also things like their own resources and assets, again to try and focus on areas that the digital solution could improve them using their own resources and not be totally dependent on providers. And then there's looking at treatment, medications, and therapies. So again, as we move along from the generally well to the chronically ill, you'll see that those treatment, medication, and therapies will change. And then last but not least, the kind of events and issues and personal concerns, as well as concerns as Kara, is it? I can't really see very well. Yes. And then last but not least, their needs. So those 4 needs are the ones that actually we would like the solution providers to focus on whenever they're addressing how their solution can actually meet the needs of this individual. Next slide, please. So today I'm going to talk to you about Randolph as an example, and give you a little bit of background about Randolph himself and the things that he is concerned with. So Randolph is an individual who is 65 years. He comes from an urban area in the UK. He's already retired. He's generally well, and he's quite internet savvy, as you can see. He has connectivity at home. He has broadband, and he has a smartphone. And then on the right-hand side, you'll see he's very highly skilled in the internet usage, mobile devices, new technology, digital health literacy, and that's really an important aspect, digital health literacy, because if someone has high digital health literacy, they will tend to obviously be more used and accustomed to be accepting any digital solution as part of their healthcare. And then assistance, how much assistance do they need? ICT use. Randolph is in generally good health, this particular persona. He lives with his wife in a city area. He used to work for an IT company, which explains his high ICT skills, but then he has taken early retirement. He's now still doing some work, but his wife now has early onset dementia, and her condition is worsening. So as a result, he is, considering what are the future developments that will in fact affect the both of them, because he is really the informal caretaker. He is also very health aware, so he does works out in the gym, and he, a couple times a week, and so he does look after his health. So generally, Randolph is high health literacy and high in digital health literacy as well. Next slide. So when we focus on some of the context behind Randolph, we see the areas that are important to him. For example, staying in good physical shape. He is involved in his local community. He also wants to be there. So part of that, staying in shape and being involved in the community will help him to be there for his wife emotionally, intellectually, physically, and financially. And he's also staying in touch online because his children who are no longer here, they have moved back to the Caribbean. So again, he cannot be reliant on them fully for support. So, but he still stays in touch with them online. Health concerns, at the moment, immediately, he has no health concerns. But as he is an aging individual, he feels that there are aspects of his age and his body that might worsen as he gets older. So he now although he wears reading glasses, he feels that his eyesight is getting worse. And of course, because he's health aware, he has read up on all the information about aging. So he realized that that in the future he might develop cataracts. So these are things that he's concerned about. On a day-to-day basis, he does pay close attention to his wife's daily agenda, because he needs to marry his caretaking duties with his own activities. He does do shopping, but again, that means he has to go out, and again, difficulty with balancing the caring responsibilities. He relies on online services, and they do spend a lot of time together, but they do also respect individual time at the moment. And in terms of health tests, they are within the UK. There's national 5-yearly health check that he can be availed of. There's standard bowel cancer checks and screening process. So again, these are the things that he be useful for him to be aware of, but certainly things that he will be eligible for. Next slide. Looking at own resources, assets, and support. And again, we know from someone like Randolph, they live in a local community that is friendly, and they are members of church. He himself is, as I've said, is very high in health literacy. He's aware, informed and alert, and he also knows that as time goes on, he needs to think ahead for himself and his wife. Currently, because he has no long-term condition or has no other ailment, he doesn't take any medication personally. He just wants to be sure that his wife also is as well as can be, and that she takes her medication regularly and has all her annual flu jabs. So there are things that he needs to be aware of, not just for himself, but for his wife. In terms of events, issues, and personal concerns, again, he misses his children and will really appreciate having their support. Again, he's worried that, as his wife's condition may deteriorate in the future, his responsibility will increase, which then means he will have less time to do what's important to him as an individual. So again, how that will impact him on the physical, emotional, and intellectual basis, he doesn't really know. So those are things that matter very much to him. And as a carer as well, he needs to be able to manage and understand what are the things that's coming up with his wife's dementia, what he may need help from his support network, and he does want to keep himself informed about the dementia field so that he can at least be prepared for what's coming ahead. Next slide. So really, for Randolph, these are there are four really key areas that maybe for solution providers to actually consider and think about. Randolph would like to know more about smarter homes, because he knows that as he's into technology, so he would like to know where, if there's areas that he could live in, or local or regional care homes, in case his Barbara may need at the point where he's no longer able to care for her, that she may need to move away from home, and where is he then going to live, and how is he going to, if possible, can he live together with her, or is he able to live closer to those care homes? And then again, any other types of online household help services will be important to him, because there might be certain things that will happen to his wife, falls and things like unexpected when crisis happens, and he may need support for, and those will be really, really helpful to him. He also feels that he needs to learn more about the condition, so he wants to be able to cope with some of the symptoms at the moment, which is any repeated questions, himself not getting frustrated, herself getting more confused, she's misplacing her belongings, and other kind of symptoms that dementia might surface. And really, the more he's prepared, the better he will be able to care and cope better with her condition. And finally, again, some of the other issues which maybe we don't think about from healthcare, but information about powers of attorney, as well as how he can take over some of the consent issues. So he wants to be prepared for any legal developments that might come in the future. Next slide.
Yes, thank you very much, Sue. That is basically, and we wanted actually to stop here without including the list of digital solutions, type of solutions that have been proposed by our industry partners, because we also want to hear from other regional representatives from the action groups and reference sites, what they would like to propose, what they have implemented for those particular needs. And definitely, apart from the need for information about Barbara's condition, and also booking service for food provision, etc. Definitely, Randolph will also need some more health information exchange related solutions, like occasional care support booking solutions, e-appointments for Barbara as well. So this is just to give you a few examples of what our industry partners suggested. Thank you very much, Sue. Now we continue with Elisio Costa, who is going to present the blueprint personas with chronic conditions and or social needs. Elisio?
Hi, good morning. Are you listening to me?
Very well, thank you very much.
Okay, thank you very much. So I'm going to present some of the personas now. In this case, personas with chronic conditions and or some kind of social needs. So we develop 4 persons in the life course or in different life course time. So we developed Millie, who is a 18 years old girl which has some health problem, namely Asperger's syndrome, and also with prediabetes, and also with attention deficits, with hyperactivity disorders. So we have also developed Nikos, which is a working age adult with 50 years old, and he presents metabolic syndrome and also mild chronic obstructive pulmonary diseases. And also we have also developed Eleni with 73 years old that has hypertension, poor medication, adherence, and also has early stage of dementia. And finally, Maria, which is a 84 years old person with some which has some health problem and also some social problems. In terms of health, she has diabetes, retinopathy, heart failure, arterial fibrillation, a mild chronic kidney disease, and also osteoarthritis. I'm going to present Maria with more detail because Maria has some of the more common problems in their. So she presents problems on adherence in their lifestyles. She has also social isolation and problems on safety and accessibility. So Maria comes from urban area from Spain. She has 84 years old, and she presents very, very low ICT skills and also very low health literacy. In summarizing, Maria lives in a flat in a third floor without central heating and without lift, and she lives with her daughter June and with her grandson John. The daughter has a chronic personality disorder, and her grandson John presents a mild cognitive impairment. So Maria has some financial problems because her pension is very small, and her family is having serious financial difficulties. She has multiple chronic conditions, and she is also a polymedicative person. So she has problems with eyesight. So she is unable to identify correctly the medication and to take the prescribed dose as prescribed. So she needs help in managing in her own health, but she rejects all social services. So let's next slide. So what is important for Maria? Maria likes to cook and being in charge with her family. She takes care of June and John, the daughter and the grandson. She likes knitting and sometimes likes also to watch TV. And also she is important for her to go to the park. In terms of the daily life, she has some difficulties in manage her personal hygiene, and their parents is very poorly. Is less able to manage her household, and the meals, the family meals, are neither balanced nor earthly. In terms of health, she has some chronic conditions that are usually under control. She has diabetes. She has health problems, namely irregular heartbeats and moderate heart failure. She has also a moderate chronic kidney disease and also problems in joint disease, osteoarthritis. So, in terms of health tests, usually they are controlled. The last results show that heart rates are normal, and baby is slightly overweight, and the glucose is slightly above normal. Next slide. In terms of researches, usually the primary healthcare team take care of the illness. She visits the health center at least once a month. She is also in touch with her niece, who also visit her 3 times a year. She has problems in managing her own health and address, because her address is very poor. She has recently been hospitalized because they take too much rapid insulin and suffer severe hypoglycemia. So, in terms of medication and therapies, she is a polymedicated person. It takes one insulin injection daily, and it takes pills for stomach ulcers, blood clots, water retention, blood pressure, cholesterol. So it's a very complex therapeutic scheme. The professionals are very concerned about some of their clinical parameters, namely blood pressure and creatinine, that are improved. And also the healthcare or social care or healthcare are also concerned because they take care of June and John, and they are very dependent from her. They are also concerned because they have Maria has good social service available, but they reject all support. Next slide. So, to finalize, what Maria needs. Maria needs help to better adhering to their treatment. I think they need also they need to improve adherence, but also she needs help to manage these all prescribed medicines. Maria is isolated, and this is a very a problem for her, and because she needs help to manage her own health, but they reject all the support. Maria needs to take better care of herself when it comes to personal and whole house hygiene, because John and June do not participate much in her care due to their own conditions. Maria has also difficulties doing the groceries as well as cooking meals because most of the meals that they do, the family, are not healthy and are not well balanced. And she also needs some help and digital literacy because she has a very low skills on health on digital on ICT. She has very low digital literacy and also health literacy. And I finish.
Thank you very much, Elisio. As you could all see, Maria is not easy to take care of, but I can reveal that Maria is actually living in Basque Country, so there is lots of support for her because telecare, telemonitoring solutions are being offered to all in need and very well organized. So I know that 24/7 e-health call center run by nurses, for instance, is available, offering health advice and support when needed. I know that many elements of integrated care have been already implemented with hospital discharge, follow-up, etc. So for Maria's needs, we have solutions being suggested by Basque Country and a few more also from our industry partners. Although she does not have any digital and very little health literacy, it's possible to support her. Maybe then go on to Maddalena Ilario, who is presenting.
Hi, good morning. Yes, I'm sorry. Can you hear me?
Now we can
Hello?
hear you better. Can you speak
Okay.
up a little bit?
Yes, I can speak up. Okay.
Thank
So I am one of A3 co-coordinators, and I am also an endocrinologist working as the director of the unit for health innovation in Campania region. And it has been quite an experience being working on these blueprint personas in this group of pioneers for the implementation of the blueprint. So can I have the next slide, please? Okay, so we have been working on the development of 4 personas along different stages of life. As it has been already illustrated, we outlined a young adult, a working age adult, a retired person, and a person over 80. And as you will see, their health condition become complex based on different needs that go from what is a more characteristic of Ben, who is 9 and will be our focus. Antonio, who is an older adult with several chronic conditions and also underwent a car accident, complicated his mobility. Procolo, who is 79 and has several complex problems due to a combination of chronic conditions plus the recurrence of bladder cancer and to the lack of adherence to lifestyles, up to Jacqueline, who is the most complex case, another case of complex need due to development of dementia. Next slide, please. If you look at Ben, he is age 9. He lives in an urban area of UK and is one of 3 siblings living with his working parents. His community is very supportive of the family because he attends a local primary school where he is supported by teaching assistants. And although he underwent a heart surgery for his atrioventricular septal defect, he is currently coping with it because the condition was fixed early in life. And He is also affected by bilateral cataracts, for which he should wear bifocal glasses, but he doesn't always. This is not always the case. He has hearing loss, and for which he brings a device. He wears a device, and he has delayed fine and gross motor skills, for which it is particularly hard for him to write. He does not like to follow a dietary regimen, and it is very hard to maintain him physically active. As I mentioned earlier, Antonio is a 33 young adult who had a chronic condition, but he also underwent a car accident. So he is now in a wheelchair and cannot go to work because his work does not allow access to a wheelchair, for which he is undergoing depression and is stressed out and it makes an abuse, high use of alcohol and smoking, and he feels socially isolated. Next slide. Next slide, please. Procolo is, as I mentioned earlier, is a complex older adult with many chronic conditions, and also had the bladder cancer, and he is particularly worried about becoming hospitalized. So he wants to avoid, on top of all acute conditions. He was a doctor, so he knows his condition can be complicated. So he tries to avoid hospitalization as much as he can, but doesn't follow a lifestyle that is supportive of this. And Jacqueline finally has dementia and is cared for by her husband because she lives too far away from home care, from a care center, and so she's relied. Yeah. So you can move to the next slide. So our focus is on Ben, but along the description of what's important to Ben, it will be possible for you to identify several features of things that are important also for the other people. For Ben, it is important to have a regular and predictable routine. He doesn't like surprises in his daily routine, and he has difficulties in reading. So he needs spoken instruction with the visual prompts and cues, and it's good for him to have a visual timetable for the day. He likes being independent, and he likes doing things by himself. His daily living is characterized by a routine, and breaking down the routine upsets him. And he also forgets packing all he needs during the day. So he needs assistance to put together all his belongings, and he cannot read very well, and he prefers the symbols. So that are also important to take advantage of his visual memory skills. His health concerns are the Down syndrome, heart conditions, and the risk of diabetes due to increased weight and also due to his condition. Plus, in his future, there can be a worsening of eyesight and hearing, and he also has delayed motor skills. He needs regular health tests that are provided by public health system. That include also eyesight and I lost the vision. Okay, so if we move to next slide, what are the Ben's resources? Ben's resources are he relies strongly on his family support and on caregivers. His caregivers, his brothers stimulate him to exercise, and the school also provides the learning support. So we know that he also attends a youth club. He's socially active. He's very socially active. His personal concerns is not forgetting things, so not having with him what he needs to do his own things during the day, not eating healthy, not exercising enough. He has a complex treatment regimen that includes some pills for heart conditions, eye drops for the eyes, and he also needs to undergo psychotherapy, and he needs to undergo regular health checks. And if we go to next slide, band need are appropriate adaptations to facilitate the use of the internet, because if you look at his use of tablets is quite good, but he cannot navigate the internet, and there's some need of support to take advantage of ICT solutions. He needs support to maintain regular communications between family, school, and doctors, because his network for health strongly involves also the community. And also he needs assistance with learning on how to organize himself, some support for, such as schedule reminders, and also health lifestyle information for his informal caregiver. If you go to next slide. So what do these people have in common? They have, they rely to different extent to the support of caregivers, and they depend to different extent on the caregivers. They also need to adhere to complex care regimens that include drugs, physiotherapy, and include adherence to healthy lifestyles, both in terms of food intake and in terms of physical activity. They have some accessibility concerns, and this goes from the wheelchair accessibility to internet and ICT tools accessibility. And also they need, and these kind of accessibility issues are also influencing their social connection. So accessibility is very important to fight social isolation. If you go to next slide, we can see what the different need from in terms of service providers. Some examples can be provided. General practitioners want always to have an overview of the circle of people of health in services that are provided formally or informally to their patients. Local authorities need to prioritize the services depending on the individual evolution of the health conditions. And acute service providers such as ambulance and emergency need to rely on immediate information concerning all aspects of the person's health in order to provide the timely intervention and timely discharge as well. We need to, public health needs also to rely on experts because these conditions need specific expertise, and also public health authority need to rely on a vision of the system that of the integrated system that supports all these people that somehow address the needs of this complex patient. And there is also a need to check for the quality of the data that are provided and of the services that are provided. So if you go to the last slide, there is a need. There are several solutions available in terms of connecting the people and providing caregiver support, like social media, memory training, discussion fora, telemonitoring, and connected care. And it will take a lot of dialogue between the demand side and the offer side in order to pinpoint which is the best combination and how can we puzzle the different solutions for a given regional service. If you click the last button, we have been attempted as the A3 action group, a sort of matchmaking between the good practices and regional authorities during last meeting we had in Verona. And we are currently trying to broaden the extent of the discussion, taking advantage of the opportunity of the HETEL symposium with which we organized an RSCN matchmaking event on December the 5th. So this is an opportunity we can take advantage of to start the dialogue and matchmaking solutions and authorities. So thank you. This was my last slide.
Thank you very much, Madalena. This was a very useful overview and also link to the future work that is before us and to the digital solutions and matchmaking and how we are taking further the discussions. Can we go to the last, I think, the last presentation? Strachil will talk us through a call for action groups and reference sites to support the next phase.
Yes, thank you. Hello, everyone. We wanted to briefly talk to you about this exercise that we have started with the B3 group. We had our deliverables in the project, officially the first update of the blueprint as deliverables submitted in November, early November, so we had barely time to present our results, but it just turned out that the B3 meeting was having their annual, or I think twice a month, they do it twice a year. They had their next meeting in November, 14th of November, and they invited us to present. So this is the first opportunity we received to present, and we want to also now extend the group to include also all the other action groups. So the idea that we had, now that we have developed the personas and their needs, and we have taken the exercise further with the 12 personas, is to identify digital solutions that address these needs. And we want to look at what solutions are available with concrete examples based on the good practices of the EIP on AHA, but also others. And hopefully we can identify also what other digital solutions are needed or are currently under development that need to be fostered. And we also, apart from that, part of that exercise is also to look at different ICT categories that can apply to these personas. So the survey we launched with B3 and want to extend to you now is to match existing digital solutions to the blueprint personas and their needs. And we think that this exercise will help to generate an overview of which can be complementary to the EIP on AHA repository of good practices. You know the repository, it is quite comprehensive. It has a lot of information about the practice, maturity level, transferability. What we're looking here is just an initial overview of what kind of solutions match the unmet needs, which the blueprint, the repository for now doesn't have. So this we see as a complementary action. And the solutions that we identify will hopefully inform our next steps in the blueprint development, which are around the so-called user scenarios that Veli mentioned earlier. So this is just an overview. We launched this exercise with a very short timeline to be able to have something for the B3 meeting middle of November. And I will not go through the details, but the idea is that if you see here, you have an overview of the personas and you have the posters. There is a tool that we developed, hopefully that makes it easy for you to read on the personas and knowing what kind of digital solutions you have implemented or are implementing in your region to tell us which of these solutions match what kind of needs of our personas. So they are based on the needs. If you see here, the needs are numbered from 1 to 4 for Randolph. So in the file, we also have these numbers below each persona. That is the idea. And as I said, we have done this with the B3 members. We're now evaluating the feedback we received. We're trying to make this exercise simple because it is quite a task to read on all the posters, personas, and to match them. So this is the other aspect that I was talking about. So based on the persona's needs and the initial solutions or types of solutions that we were suggested from our industry partners from the Blueprint Group, we did this kind of grouping of ICT categories. You can see here we have solutions that relate to education, gamification, health and digital health literacy. We have solutions that relate more to smart homes, especially, for example, for Antonio. We have telehealth, and we may have others. So this was done rather quickly for our deliverable, and we were asking for your support in further elaborating on these categories. There might be other categories that we have missed. There might be a better way to subdivide these categories. So this is one part of the exercise along with the digital solutions. We have some feedback from the B3 meeting. Maybe to save time, I will skip most of it, but we got some useful feedback already. For example, the idea to drill down into the need. So when we're looking at the need that we have defined, whether that's really the need or whether we should go deeper, we should focus also on regional and local perspective. Other suggestions were to incorporate the needs of informal carers. We saw a good example with Randolph, but not all personas have this aspect as strong as it was in Randolph. Other blocks that were suggested as part of the posters could be related to health insurance, the needs or the aspects of the general practitioner, and other. So in terms of the ICT categories, we have also some useful suggestions to include digital assets that the person has, whether they have a tablet, a smartphone. And another idea was to indicate how big of an impact this persona has on the European population. So how much of the population in the European Union does the persona represent? And we're also working on that. So these are some suggestions that we're working on, and we're welcome you to submit your own in a few moments through the question and answer, but also contacting us via email. With this exercise, collecting digital solutions, it is important to say that we do not want to compare any solutions or to make any statements about the quality of these solutions, superiority of one solution to the other. We really want to provide an overview, and we want to ask you whether this makes sense for you, because most of you participating are the action group coordinators. So we want to extend this exercise now all action groups. But of course, it is important to have some benefit out of this, and we see a potential benefit of this exercise. As you see here, one would be to foster collaboration between demand and supply side. This worked very well in the B3 meeting, where we had a list of the submitted digital tools and we have the needs. So we bring together demand and supply players who discuss how well they, for example, the supply discuss how well they meet the demand aspects, and they get some tips, for example, that can inform their future development, needs that are not met by their solution. On the other side, the demand side organizations can hopefully use the personas to elaborate procurement specifications. It is typical that you have, during the specification phase, you're looking at users and what kind of functional needs they have. So maybe these personas can be used in this process. In addition to that, hopefully this helps to identify areas of needs which can further be stimulated, that are not well covered right now and should be further fostered through funding, through procurements, etc. So this is where we see the benefit of this exercise, but please do tell us whether you think alike or whether, this is helpful for you. With that in mind, I think we have now a question and answer session, around 20 minutes. So if everything works as planned, you can use in your webinar panel the option to raise a hand. So I will see who raises their hand and I will unmute you. You can ask your question and then we'll try to answer. If we cannot, we promise to take note of it and answer separately in an email. We know all of the registrants, so we can send a follow-up email. If you prefer not to pose your question orally, you can also use the chat function. So we'll collect these questions as well and try to answer them as soon as possible. So if you do have some questions, not just on this presentation, but on all of it so far, please either raise a hand or ask a question. And we just need a few moments to read the upcoming questions. So maybe I can start with a question by Isabella Springhetti. What you mean by sliding bars? So I will go quickly to a slide that has sliding bars. These are part of the posters. Here are the sliding bars. So we just mean the level of ICT and other skills. It's mostly ICT skills, but also digital health literacy. So we had a 5-step approach. So a digital health literacy level could be from 1 to 5, whereas 5 would be the highest. It just indicates the persona's level of skills.
There is another comment by Willeke that about the level of education of the personas. Right, education is very important as an indicator for health and well-being, she's writing, and providing an advice to add the education level for the personas. To a certain extent, we do cover this, we do address this by the sliding bars. Trahil, if you can show again the picture of the sliding bars through digital health literacy. Actually, what we mean, and it says digital health literacy, but it does include as well health literacy. And the other indicators on affinity to new technology, internet usage, does the persona need assistance with the use of digital technologies, do address the digital part of the education of the personas. So, but thank you very much for the comment, and we will need to think about this. Is it necessary in addition to strengthen further the education, the information? Are there other comments?
So we can take maybe one comment from Chariklia. I'll try to unmute you now. No, it's not working. Sorry, it's not working, so please write your question in the chat section. Madalena?
Yes, I just wanted to a couple of observations. One concerns the reluctance of families and caregivers that is often on receiving extra social support, and I can imagine it might be even worse if we try to provide support that is digitally embedded. Probably developing a culture of health together with the caregivers and towards a new shape for our health system would be important. And this would also include strengthening the digital skills of social workers and the workforce that provide support to families and informal caregivers to bridge the gap of digital literacy for the older population. It's just something that might be taken into account. If we want to bridge the digital gap, we also need to create a new culture of health that makes some solutions more acceptable in our cultural model. I think this is also something probably Chariklia wanted to stress out, because we have been working together on this. Thank you.
Thank you very much, Madalena, for this. Willeke has added that Oh,
She can speak.
oh, you can speak now.
Ah, sorry. Oh, okay. Sorry, I thought this is Willeke van Staalduinen from the Netherlands. I was thinking education level is it is known that people from university, for instance, or have better and healthier life years than people with lower education or no education. And only focusing on digital education is, to my opinion, is a bit too limited. I would stress to underline that I think it is also important to involve if someone is from university or lower skilled. That's what was my point. Thank you.
Thank you very much. We will consider that, of course. Then Cheriklia is posting a comment. Let's talk about health inequalities. Is it still possible to?
No, I'm not sure why.
No, we cannot unmute you, unfortunately. This is really annoying. Apologies for that. We don't know why it doesn't work with some of you. Health inequalities. Right. Very good point. Meaning probably where the person is living, or if you can provide further comments on that and details, that would be really helpful. Vanya Lazic was asking about changes to the persona sheets. Yes, there will be changes and improvements for sure, of course. We do not expect this to be major changes because they were extremely valuable additions. But this is not a major change then. We will be working on that and will inform you when exactly we can publish those. Okay, health equity means refers to accessibility to high quality services for all, is the comment by Madalena. And Cheriklia is writing that it's the key to all we are trying to achieve. We fully subscribe to this. Equal access to innovative care and cure is another comment by Madalena. For this, we fully agree, and this is also reflected by some of the comments provided at the B3 meeting to provide an additional or better focus on innovative solutions for diagnostics and therapy. And we do have, for some of the personas, and in particular one, a very innovative solution, but we will need to further stress applications using artificial intelligence, for instance, also more complicated diagnostics tools, etc. Please send us comments like this. It will be very valuable for us. Are there further comments? Madalena is writing again about financial sustainability schemes for new paradigm of care and cure. This should be highlighted, of course. It's also very important. And there are also recommendations along these lines provided by the Blueprint partners, including Madalena, of course, already for the Conference of Partners contribution that we had in February 2017. we will continue working on those recommendations and align them with the further development of the blueprint. How about looking at the important variable of increasing social cohesiveness? Right, we will be looking into that as well. Thank you, Cherokee. Sue is wondering if not just rural and urban divide, but whether the persona lives in a socially deprived areas as part of health inequality issues should be as well discussed. Also a very valuable comment. And Paula is writing, which skill for the workforce to improve communication and proactive care? This is definitely a very important issue. Thank you for that. We have not stressed this enough up until now, partially because we are not able to, were not able up until now to develop equal type of personas and their needs what regards the workforce in the health and social care sector. But we will be working on recommendations for this. Related to how can we support the carers to provide optimal care to these personas. In this context, we will for sure address this issue. I think these were all comments more or less, and you were all hopefully able to download the presentation because it was posted on the link for the webinar. We are showing now as a last slide how the process will continue. Madalena already announced a session that we will have just after the ETEL symposium on December 5th in Brussels. Campania region is hosting this event, and for instance, from you, Anna Maria Cariazzo will be presenting there. She will be focusing on. Can you unmute Anna just for a second? Anna, could you please tell us what you will be talking about at the ETEL blueprint session? We did unmute you, but we are not able to hear you, Anna. Okay, this seems it's not working very well. Anna will be presenting how the RAIA provides ICT support to integrating healthcare in Andalusia. And there will be also further presentations by Turkey on patient access to the electronic health record in Turkey. A representative of the Ministry of Health will be speaking to that. And Regina Roller-Winsberger, and she is with us today, will also report on training programs for digitally literate nurses in Styria. And we will have a presentation also on hospitalization at home in Puglia. So just to give you some more information on this upcoming session. And then there will be the Conference of Partners end of February, early March in Brussels, where we will organize a workshop again. With this, we would like to conclude. Thank you very much for attending today, and we look forward to your further comments and contributions. We really very much appreciate your support. And thanks very much, Anne, for joining us today and providing such important information on EC development. Thank you. Have a nice day and a nice afternoon.